So thank you very much for being here today. And we are in December already, first Thursday of December, December 2nd. And we are right around Christmas, and maybe this is not the happiest topic to have during happy holidays, but you know what? It's very important information that we need to have. So thank you to all of our attendees for being here today. There are other people that might have registered for this, but don't have access right now, or they're busy right now, they're working. So we're gonna be sending the link with the recording later to everybody who registered. And with me today to talk about a stroke and how to prevent it, treat it, medications, everything about a stroke, we have two great people, definitely experts in the field. So I'm gonna go ladies first. So I'm gonna go with Dr. Mohini Gurmi. She's a doctor here. She's a neurologist. She's here at Montefiore Nyack. And then Steve Monson, who's been working with patients with a stroke. He's a registered nurse, and he's been working with patients with a stroke and doing a stroke education for a long time. But I'm not gonna say too much about them. I'm gonna let them introduce themselves. And of course, I'm Sandra Arevalo. I'm the Director for Community Health and Wellness. Glad to be here with you again this week. So Dr. Gurmi, do you wanna talk to us a little bit and introduce yourself? Tell us a little bit about you, your career. How did you get involved with neurology and a stroke?
So my name's Mohini Gurmi. I'm a neurologist with Highland Medical and Montefiore Nyack Hospital. I'm also a chair of the stroke committee here at the hospital. So I got into neurology sometime during my medical school training. I don't think I went into medical school thinking I was going to become a neurologist, but I really enjoyed my rotation there, and I found the field fascinating. And so I let that kind of guide me towards going into neurology. And then while in neurology, I pretty much liked most facets of neurology, most diseases. So I decided to remain a general neurologist, but I have some specific interests in various areas of neurology, one of which is stroke care. I also do have some interest in neuromuscular diseases. Some of you might also know that I do some of the nerve muscle testing for our group. So that's a little bit about how I got here.
Okay, thank you so much. And Steve, who sits right across my office. So we're neighbors also here. So why don't you, besides saying that was the most important thing, of course, why don't you tell us a little bit about your professional history?
Yeah, my name is Steve Monson. I'm a registered nurse at Montefiore Nyack. I've been here, I guess, 11 years. Before becoming a nurse, I worked as a paramedic for about 25 years in North Dakota. That's why my background here is the Badlands. So that's one of my pictures. And during that time, I also worked helicopter and fixed wing or airplane transport. So I've seen stroke from different areas and different views, I guess, than Dr. Gurmi, but she's obviously the expert, but I'm just here for the other part. I see a lot of stroke patients in the emergency room. The only thing I haven't really worked a lot on is inpatient stroke. It's mostly been emergency medicine since I started working as a nurse. So, and here we are.
Thank you so much. Yes. Oh my God, that's exciting. I didn't know that you did all that. And let's get started with this, Dr. Gurmi. How do you wanna do it? I know what I like to do is that we like to invite our participants to write questions about the topic. You know, not every day we get the advantage to be talking to an expert about a topic that is of our interest. And we certainly wanna encourage everyone to write as many questions as you want as possible. Either use the chat box, the Q&A box, and I'll be reading you guys the questions. But at the same time, I know that you have prepared a little presentation about some of the topics that you want to talk about. So why don't we start with that, and then we move on with questions? Is that a good idea for you?
Yeah, I think that sounds good. If anything, it's a brief presentation. I just kind of wanted to serve as an introduction to the topic, and maybe it'll encourage some questions or make you think of things you didn't think about before. So yeah, there'll be plenty of time for questions after.
Excellent. Thank you so much. So go ahead.
Okay, so to begin, the topic is stroke, what you need to know about stroke. So some of the objectives of this talk is to be able to identify stroke symptoms and to understand the importance of getting to the hospital or getting help right away. So more than 140,000 people die each year from stroke. It's the leading cause of serious long-term disability, and the outcome depends on how and when the patient is treated. So in other words, if there's one takeaway from this topic, this is it. It's time equals brain. So to begin, I just want to set up a scenario here. For instance, say you're out to dinner with your 76-year-old father. While having a conversation, you notice that he suddenly has trouble speaking. He starts to slur his words. You cannot understand what he says when you ask him if he's okay. You notice that his face appears twisted. When he stands up to walk, he collapses to one side. So that case exhibited a few symptoms there that should alert you to the possibility that someone is having a stroke. One mnemonic that can be used that can be helpful in just making a quick assessment of someone is to use be fast. And this is a mnemonic we're beginning to use a little bit more in our hospital for all of our healthcare providers to be aware of and use. So be fast. B stands for balance. Does the person have a sudden loss in balance? E is for eyes. Has the person lost vision in one or both eyes? F is for face drooping. Ask the person to smile. That's a quick way of determining if there's some asymmetry to the face. Arm weakness. Ask the person to raise both arms ahead of them or in front of them like this. Do you see if one arm starts to drift down? That can indicate some subtle weakness. Speech difficulty, that's S. Ask the person to try and repeat a sentence. The sky is blue. And see if they're able to repeat that to you correctly. Look for things like, are they slurring their words? Is it difficult to understand them? Are they misplacing words? Like they're saying, instead of the sky is blue, the sky is red. Time to call 911. If the person shows any of the above symptoms, even if the symptoms go away, call 911, get them to a hospital immediately. Some other things you may want to look at that could also indicate a stroke, but didn't quite fall into this be fast mnemonic is sudden onset, numbness or weakness of the leg or of just the arm, confusion, trouble understanding, severe headache with no known cause. So why is it important to seek medical attention even if the symptoms go away? This is an important question because I think a lot of times people, what I often see, unfortunately, on my side of things is that people will experience these symptoms and then if they go away 10, 15, 20, 30 minutes later, there's some tendency to kind of ignore the symptoms, wait on them, maybe seek attention or seek out their doctor for a visit in a couple of days, couple of weeks. But I'm going to try and explain to you why it's actually better to still seek immediate attention right away. One of the possibilities of what you're experiencing is something called a transient ischemic attack, or TIA. This is basically like a mini stroke or a warning sign, and that's the way to take it. A warning sign is essentially what we think a stroke that's about to happen, but clears up on its own. They've done some long-term studies on patients who have had ischemic strokes versus these mini strokes or warning signs, TIAs. And if you look at the data and you follow these patients out, your greatest risk for having another stroke is after you've had one stroke. It's basically indicates that you have a high risk for strokes or TIAs moving forward. So 30 days after someone has had a TIA, there's a 4 to 8, after someone's had a stroke, there's about a 3 to 10% risk for having another stroke. Interestingly, there's about the same percentage or risk of having a stroke after you've had a TIA. So if you look 30 days out, 1 year out, or even 5 years out of having some event, whether it's a TIA, those are symptoms that cleared up on their own, or a stroke, your risk of possibly having another stroke is about the same for both of those conditions, following them through. So that tells us that a TIA is a warning sign that it's something that we need to take seriously, and we often will approach it and do the same types of testing to evaluate a person with the TIA as we would for someone who's had a stroke. Okay, so I kind of go back to this a lot. Time equals brain. So what do you do now with that person who you're concerned may be having a stroke? Check the time so you know when the first stroke symptoms started. There is a clot busting medication called tissue plasminogen activator, or TPA. It's given intravenously, and this may improve the chances of recovery from a stroke, but it can only be given if you present within 3 hours of your stroke symptoms starting. Studies show that a shorter time to getting this type of treatment is one of the factors associated with the good outcome. And another important part of all of this is, I've kind of focused on treating a stroke, or what do you do when someone's had a stroke? What people don't always realize is that there isn't a lot that we can do or offer when someone's in the midst of having a stroke. A lot of our care, our treatment, is supporting the patient. A lot of the tests we send the person for is to understand the stroke better so that we can prevent the next one from happening again. Part of that is prevention. So some things we might start a patient on after they've had a stroke or TIA, or even before if they show some risk factors. We recommend a blood thinner. These are usually antiplatelet agents, or aspirin is the main one. Baby aspirin's 81 milligrams. We also recommend a cholesterol lowering medication, specifically a statin. The one we use here at the hospital is atorvastatin, or Lipitor. We also control other vascular risk factors. Recommend a blood pressure being as close to 120/80 as possible. Evaluating for the possibility of diabetes. We recommend tight blood glucose control and being aggressive about getting diabetes under control, and lifestyle modifications. So diet, exercise certainly helps. One of the diets that has had probably the most attention and shown some benefit in reducing your risk of heart disease, which is one of the risk factors for stroke, is a low salt diet, or the DASH diet. And if someone is a smoker, we recommend quitting smoking. Smoking is probably the number one thing you can do for yourself to reduce your risk of stroke. Okay, so thank you. And if there are any questions, just let us know.
So thank you, Dr. Gourmet. Yes, so there are some questions that I have, and at this point, I invite everybody, all of our attendees, to please write your questions as well, either in the chat or Q&A boxes. We will be very happy to answer all your questions. So thank you for a great introduction, and let's rewind a little bit, and let's start with the basics. What is a stroke?
So a stroke is basically a lack of blood flow to a vessel that supplies part of your brain. So that can be from a blood clot, that can be from other inflammatory factors, but there's something that creates a lack of blood flow to a certain part of the brain, and then that brain gets injured, giving you symptoms.
Mm-hmm. And you also mentioned TIA, transient ischemic attack. Mm-hmm. So what's the difference?
So with the TIA, With the TIA and stroke, patients present very similarly. They present with stroke symptoms, which can include some of the things I had mentioned in the talk, a droop to the face, weakness on one side of the body, trouble speaking. In a stroke, these symptoms tend to persist. And when we follow them through, and if we confirm that the patient has in fact had a stroke, these symptoms can last sometimes weeks to months. And that's due to the injury to the brain from the stroke itself. With the TIA though, what happens is, like I said, it's a warning sign. So it was a stroke that was about to happen. There's an area of the brain that's starting to get a lack of blood flow, and there's an injury that's beginning to happen that's giving you symptoms, but then it clears up on its own. So the symptoms should completely resolve. Generally, the symptoms will last at least 30 to 45 minutes as our typical definition, or typically what we see when we diagnose a TIA. And they should completely go away. And then when we do the follow-up studies to understand why this has happened, we actually we should not see any area of injury when we do like a CAT scan or an MRI of the brain.
Mm-hmm. And how are stroke and heart disease related?
So they're very interconnected. The way I would relate them is really heart disease is a product of vascular disease. Vascular disease in general is what we focus on treating to prevent our risk of or to lower our risk of heart attacks and strokes. So vascular disease or vascular risk factors include high blood pressure, high cholesterol, diabetes. These are all conditions that can lead to the development of plaque or narrowing or buildup in our arteries. And these are arteries that not only supply the heart, but also supply the brain. So that's why these two conditions are interconnected, and we approach them in the same way.
Mm-hmm. Are aneurysms also connected?
So that's a good question. Aneurysms are actually, they are related to vascular disease, but what it is actually a weakening of the artery. And because of that weakening, an outpouching is created. And sometimes that outpouch can burst. It has because of the weakness in the vessel wall. That's one of the things we kind of watch out for, or it has a high risk of. So that makes it a little bit different from stroke. So when someone has an aneurysm, it's due to a weakening in the part of their vessel. If it were to burst, it can create what's called a hemorrhagic stroke, which is a bleeding stroke. It's a different type of stroke than what I've been focusing on. The focus has been up till now on ischemic stroke, which is a lack of blood flow to a certain part of the brain causing injury, and that's due to a blood clot. Aneurysms raise the risk of hemorrhagic strokes, which are strokes that involve some bleeding in the brain, and that's because of a burst in the aneurysm.
Mm-hmm. Thank you. And we're starting to get a question. Hold on. Can high cholesterol alone cause a stroke, or do all the other factors like high blood pressure, etc., need to be present? What is considered to be high cholesterol or a reason for concern?
So that's a good question. I don't know that we know for sure if high cholesterol alone is a risk factor for stroke. Generally, we see that it's a combination of vascular risk factors. So high blood pressure along with high cholesterol, diabetes, your family history. If there is some family history of stroke, that could also put you at a higher risk of having a stroke. When it comes to high cholesterol, the recommendation is that your LDL, which is the bad cholesterol, is less than 130. If you've had a stroke or heart attack, that goal actually becomes lower. We want that LDL to be less than 100. And statins have been our typical go-to medication to achieve those goals because they've been shown to be very effective at doing that for us.
And I know you touched on this a little bit earlier, but I just want it to be clear. What are the risk factors to a stroke?
So risk factors, so anything that's a risk factor for, we call them vascular risk factors, risk factors for like heart disease in general. So high blood pressure, high cholesterol. The high cholesterol we think might play some role in the development of plaque in our arteries, which can become a source for heart attacks and strokes, and the blood clots that lead to those conditions. High blood pressure, because with the pressure being high in our vessels, it creates an environment where there's some inflammation in the vessels that can lead to strokes, or it can create a situation where there's so much pressure in the vessels, small ones can actually burst and cause strokes as well. Mm-hmm. Diabetes is another risk factor. Diabetes, what we think is the link between that and stroke is also, we think that it contributes to this highly inflammatory environment, especially in our small vessels of the brain, and going along hand in hand with high blood pressure, high cholesterol, creates a situation where you may be more likely to develop a clot or have a stroke. I would say those are the three main things. Lifestyle-wise, smoking is really the number one risk factor. Again, creating a situation, we know it adds to vessel or vascular disease. So it creates a situation where you're at risk for stroke.
And Dr. Gourmet, are there other options for a stroke treatment beyond the clot busting medications?
So yes, there is. This is an area of stroke neurology that's really been getting a lot of attention, and there's been a lot of developments just in the last few years. But TPA has really been around, available for a long time. It's a tissue plasminogen activator. It's an intravenous medication that we at Nyack Hospital are capable of providing patients. If a patient presents within that 3 hour stroke window, sometimes we can extend it up to 4.5 hours. But beyond that, we really can't give that medication, and that's per our guidelines. Additionally, if a person is showing or exhibiting certain symptoms that suggest a certain type of stroke, this is called an embolic stroke, where it's a stroke that's affecting a larger vessel of the brain and therefore has a potential for a larger area of injury and of symptoms, more symptoms for the patient. They may be a candidate for a neurointerventional procedure. So this is a procedure that's done at our parent hospital, Montefiore Stroke Center. And they have interventionalists there. These are basically doctors who can, with catheters, actually go into our vessels, go to the area where the clot is that's creating the stroke, and either break it up or suction it and dramatically improve someone's potential for recovery from the stroke.
Mm-hmm. And I think with that, you solved a few of my questions, because one question that I wanted to ask was if a stroke is hereditary.
Hereditary?
Yeah.
Yes, it can be. If there has been multiple family members who have had stroke in your family, it could indicate that you may be at a higher risk for stroke. But what's also been shown, just to, looking at the positive side of things, is addressing those vascular risk factors, being aggressive about eating a healthy diet, exercising, getting your blood sugar down, getting your cholesterol down, your blood pressure down, can help offset those risks.
And someone is asking, are there any difference in the symptoms for a stroke, meaning between women and men? Do they feel it differently?
That's a good question. I think it's an area that is starting to get some attention. By and large, I would say men and women, there may be some variances in how they present, but um, the symptoms I had talked about are pretty general and pretty standard for what we typically see in stroke patients, whether they're men or women. I think where there could be some difference and where I think we need more information and we need to study this a little bit further is in the risk factors for strokes. I think these vascular risk factors like high blood pressure, cholesterol, things like that. I think the reasons for why these develop can be different between men and women, and how we can treat them and address them can be a little bit different between men and women. So I think that's where we need to understand the difference between men and women when it comes to stroke. But generally the presentation I found to be similar.
Mhm. And let me ask you something. How does an individual experience a TIA? Can an individual just have a TIA and never know about it, or not to be able to find out, years later, or do you always feel it?
It's a good question. So TIA, the one thing about it is that there's really no way of confirming that someone has had a TIA. There's no blood test. MRI is not going to show it. CAT scan of the head's not going to show it. It's purely based on what the patient experienced clinically. So it's very well possible someone may have experienced these brief symptoms, and because they went away, they didn't make much of it and may not have sought help, or just kind of forgot about it and went on. And unfortunately, sometimes it's the stroke that can sometimes happen later that people are at risk for after they've had the warning sign that prompts the patient to seek attention, and then we do a workup and stuff. So on the flip side, I've also actually seen patients who haven't realized that they've had a stroke either. And sometimes we don't. I've done imaging studies for patients to evaluate one thing, and then sometimes I'm surprised to see that, oh, they've had some stroke in the past. And when I go back to the patient to ask them about it, they really don't recall experiencing any symptoms at all. So it's always possible to not be aware of it. But I think the important thing is, if you do notice sudden onset of symptoms involving your speech, vision, your strength, to err on the side of seeking attention right away rather than kind of ignoring the symptoms and waiting.
Mm-hmm. And what happens after a stroke?
So after a stroke, do you mean like what happens in what do patients experience, or like how we approach them?
Yeah, like how do you approach it? Like, for example, if somebody has had a stroke, what will be the next steps? I guess we spoke about having to go to the ER, but then you're going to have to come home, or you're going to have to stay in the hospital for a few days. Like, what's the process?
Okay, so say you're the ideal patient, you're starting to notice symptoms and you're able to get to a hospital right away. If you're within 3 and certainly 4.5 hours and you're a candidate, we can give you this intravenous medication as long as you meet criteria. Or maybe you're a candidate in addition, or as an alternative to some sort of interventional procedure. Once that's happened, then generally you're going to stay in a hospital setting. You're going to get, because you need to be monitored, nurses, doctors know to do frequent neurologic assessments on you, at least for the next 24, 48 hours. What people don't realize is that up to 3 days after a stroke, symptoms can fluctuate a bit and your stroke can somewhat settle in. So it is important to be monitored closely, to stay in the hospital. we support your blood pressure. So we actually let it ride a little bit on the higher side to just ensure that blood is getting to the brain to try and minimize the stroke extending and getting worse. And as part of all that, we also send you for some tests. The tests are really to get a better understanding of why you had the stroke, so that before you leave the hospital, we have you on the right regimen to help protect you against any strokes moving forward. And as I mentioned before, they usually involve some sort of blood thinning medication, like an aspirin, and in combination with the cholesterol lowering medication statin. Then as you're in the hospital, you're also going to get evaluated by a physical therapist, occupational therapist, speech therapist, to make sure to see if there are any needs in those areas that you could benefit from, that you could benefit in getting therapy to help improve. And so if there are areas where you could continue to have improvement, then they come up with a plan. Some patients will go to an inpatient rehabilitation facility. So right from the hospital, they'll go to a facility where they stay there for about 1 or 2 weeks, get aggressive therapy on a daily basis before they transition going home. Or some people will go home and get the therapy as an outpatient.
And, we're getting a question here. Today, the number of children with obesity and high cholesterol increases. Is it possible that a child or teenager has a stroke?
It's very rare, but I wouldn't say it's out of the realm of possibility. And we are seeing a trend where younger and younger kids are showing signs of vascular disease, whether it's being diagnosed with diabetes at a young age, and it's more type 2 than type 1, high cholesterol, and even blood pressure being high. Generally, when we're younger, though, we haven't lived enough time for our arteries to really have developed clots, plaque, things like that. So it is rare to see strokes in younger kids, but it's not unusual nowadays, unfortunately, to sometimes see 40-year-olds, late 30-year-olds having strokes.
If, let's say, I'm with somebody who's having a stroke, first, how do I need that help, that person needs help? And second, what could I do to help?
If you're with someone and you're concerned that that person may be having a stroke, the best thing to do is really just note the time and call 911 right away.
Okay. Steve, I want to hear your voice a little bit.
You do?
Yeah. So what can you?
You're not the expert here, though. So why you want to?
What else? No, but you are in helicopters transporting people, and you are in the ER all the time, and seeing these firsthand. So what else can you tell us about the stroke?
Like Dr. Gourmet, I mean, the time is the big thing, and we see that all the time in the emergency room. And it's really kind of sad when somebody comes in, they say, that they've been kind of feeling off for, half a day, and then they come in and, they get diagnosed that, yes, they were having a stroke, and there's really not much you can do. If they come in earlier in the day, makes a big difference. I read a lot of literature, calling 911 is important. Don't transport yourself. I mean, we do a good job here of screening patients in the waiting room, but, if you walk into the waiting, you have 3 hours, like Dr. Gourmet said, for the TPA. And if you come in by car, the transport time might be about the same amount of time, but by the time you get to the emergency room, you sign yourself in out in the waiting room. Maybe you don't, really express what's going on really well, so they don't pick it up immediately. You might delay you're getting in to be evaluated. So I don't think we've ever actually seen anybody get outside the window because they came through the waiting room rather than through the ambulance entrance. But it's a possibility that, if it's a really busy day, you might get lost in the shuffle, where if you come in by 911, you go right in to the ER door, you're evaluated immediately and put in the right place. So time is really, really important on that. So
yeah. Well, thank you.
Plus they know where to go. I mean, it's,
No, thank you for the tip.
In this area, we have a lot of, there's a lot of hospitals to choose from. But luckily, we have, good hospitals within a short amount of time from pretty much anywhere in Rockland County you're going to. So, both, both hospitals are able to treat,
Can you drive while you're having a stroke?
No, don't drive
Drive
while you're having.
yourself to the hospital, for example.
You may be able to. I've driven when I shouldn't have a few times, but you shouldn't do it because, the stroke, you may just be having like I said, some of the signs and symptoms are kind of not that obvious. Maybe the severe headache, or you might have slurred speech. Obviously, you could drive while you're not able to speak, but it might advance and get worse as you're driving, or you might lose feeling on one side of your body, and that's going to make it difficult to drive. We have had patients come in that, one that I think of when you're talking about younger people, we had a younger person that came in that had a car accident because they thought their brake wasn't working. And they came in, we actually thought they were a trauma when they came in and started assessing the patient, and they actually weren't able to use their right leg at all. So they actually were having a stroke. That's why their brake was fine. It's just they couldn't use the brake because their leg wasn't working. So you may not know, that you have the deficit, and it might cause you to have an accident, which an accident on top of a stroke is not a good thing, because that might keep you from being able to have the TPA, the clot busting medication. If you have any trauma, then one of the risk factors of the TPA is bleeding. And if you have any, if you had a car accident, might not be able to give the TPA because they're afraid you might bleed from other areas. So definitely don't drive yourself. Somebody, if you're not going to call 911, have somebody else drive at least. But
yes.
I would recommend calling 911. So.
And we have a question here. Are you at greater risk of a stroke if you have a high systolic blood pressure, I guess, as opposed to a high diastolic number?
It's a good question. So our goal for people, their blood pressure to be 120/80. I think a lot of the focus or attention tends to be on that top number. If the top number is high, that will usually prompt your primary care provider or cardiologist to put you on some blood pressure medications. I don't think it's as common that we see that the diastolic, the bottom number be high with the top number being normal or low, but if, I don't think it's out of the realm of possibility, but if the diastolic, the bottom number is high as well, do recommend medication to bring that down.
Okay, and do migraines cause strokes, or can a migraine end up on a stroke?
So migraines, migraines can, like a headache in general, can be experienced by patients who are having a stroke, but migraines in and of themselves are not strokes. They don't necessarily mean you have a higher risk of stroke. Migraines, we think, we don't completely understand, I think, why some people have a tendency towards migraines, but we do think it may have to do with some sort of nerve response, or maybe a response of some of the vessels in your brain, and the way it presents to you is that you get head pain. When it comes to migraines, or when it comes to strokes, if you're experiencing a headache that's unusual for you, like something that's more severe than what you've ever experienced before, say you are a migrainer, if there are symptoms to this headache that are different than what you normally experience with your migraines, those would be reasons to seek medical attention right away.
And let me see, I think there was another. Today, the number of children with obesity and high cholesterol increases. And no, I think that's the one that we did before about the children and the teenagers. Okay. So another question for you is, are there any medications or anything that we can take to help prevent a stroke?
If you're an otherwise healthy person, then really just being careful about what you eat, trying to eat well, healthy, and maintaining healthy lifestyles, exercising, that's really the most you can do and the best you can do for yourself in protecting against strokes and heart attacks. If there is, if you start to develop any condition, so this is why it is good to have a primary doctor and make sure you visit your doctor regularly and you go for your annual exams. If you're starting to develop issues like high blood pressure, cholesterol with your annual exams, it's showing up, or in your blood work, then addressing those, whether it be with diet or with medication, will help to reduce your risk for stroke.
Mhm. Excellent. So I don't know if people have any other questions. Please write your questions right now, because we're running out of time here. So Dr. Gurmey, do everyone who have a stroke need to go to rehab?
Majority of stroke patients do benefit from some sort of rehabilitation. Not everyone, though, will require that this rehab take place at a rehab facility. Some people, depending on how symptomatic they are from their stroke, may be perfectly fine getting this therapy done as an outpatient, meaning they go home and then they go to get therapy at some place like Helen Hayes or Burke Rehabilitation Center as an outpatient basis 2 or 3 times a week for a couple of weeks.
Mm-hmm. Okay. And how long does it take to recover from a stroke?
So that can vary, but by and large, I would say symptoms can last weeks to months. And that's what I tell people. Stroke recovery can even occur over the course of years. Okay, so it's not always a situation where you're going to see improvement like on a day-to-day basis. It takes some patience and motivation, but with the therapy, that's when we really start to see patients get some improvement. And the goal of the therapy is not necessarily to recover strength in a part of our body that may be weak. It's to learn how to compensate for some of that weakness as well, and to so that you can maintain your functioning.
Mm-hmm. Mm-hmm. Okay. Well, we're not receiving any more questions, so we're out of questions right now. Okay. So just double checking that we're answering everything. So I think that a lot of people, myself included, are definitely scared of having a stroke, and we see that it's more popular than we think. Like, what will be, just to close, your latest recommendations, for someone who's healthy, someone who's not thinking, oh, I'm going to have a stroke or anything like that? What do you recommend so that this is something that we never experience if we've never had?
Yeah, I wish there was some like magic pill or something that could protect everyone against having a stroke. But if you're otherwise healthy, then really like the most you can do and the most that we know of to do is really to try and just lead a healthy lifestyle. So try to be good about what you're eating, that, try to eat certain foods in moderation, try and avoid developing diabetes. So you want to make sure, again, diet plays a role in that. Try to avoid foods with a lot of high cholesterol. So maybe substitute with foods with more fiber, and try to lead an active lifestyle. Exercise is great, not only for
Losing weight,
organs of your body, but your brain. The more you exercise, the more you're getting blood to your brain, the more some of those vessels open up, and it can also even kind of trigger newer vessels forming. So exercise is really shown, and I think we're starting to learn a little bit more about the benefits of exercise. But exercise can really be helpful in maintaining your heart health and your brain health.
Okay. Well, thank you so much, Steve, Dr. Gurmey. I think at least I know more about the stroke right now. Not that I feel that I know it all by any means, so, or that, you know, I'm gonna know how to help someone with a stroke, but at least, you know, at least I got a better understanding of the difference also from stroke and TIA and the symptoms. I liked your Be Fast slide. I think that that's very actionable, actually, not just for ourselves, but if we are with someone who's going through something like that, you know, the Be Fast slide is very good. And with that, I think I'm closing for today. I just want to invite everybody next week. We're going to be talking about LGBTQ care and why is it necessary and different. So if anyone is interested, I will see you next week. Please talk to your friends, family. Let them know that we are here for you. Thank you for your questions. Thank you, Steve. Thank you, Dr. Gourmet. We'll meet soon again. And thank you to all of our participants. See you next week.
Thank you, Sandra.
Thank you.
Bye. Have a good day.
You too.